Former Fox News medical contributor Keith Ablow accused of sexually exploiting 3 patients. The prominent North Shore psychiatrist is facing lawsuits from 3 female patients who say he lured them into degrading sexual relationships, including beatings, conversations about bondage, and in one case, getting a tattoo of the doctor's initials to show his ownership of her, according to the court documents. The women allege that Dr. Keith Ablow, an author who was a contributor to Fox News Network until 2017, abused his position while treating them for acute depression, leaving them unable to trust authority figures and plagued with them feelings of shame and self-recrimination. He began to hit me when we engaged in sexual activities, wrote one plaintiff, a New York woman, in a sworn affidavit filed with her lawsuit. He would have me on my knees and begin to beat me with his hands on my breast, she wrote, occasionally saying, "I own you. You are my slave." Now, pause for a second. Keith Ablow is a psychiatrist. So understand that he's scoping and peeping out his patients to find out which ones that he can turn into this type of situation, 50 Shades of Grey situation. Okay, but he is a psychiatrist. It is illegal for a psychiatrist to engage in romantic situations with patients because you can't mess with somebody's head and then mess with their head. Okay. The malpractice lawsuits, 2 of them filed on Thursday in Essex Superior Court and a third filed last year, paint a picture of a therapist who encouraged women to trust and rely on him, then coaxed them into humiliating sexual activities, often during treatment sessions for which they were charged. So they were paying him to be abused. Ciao. When the New York woman had trouble paying her therapy bills, she said Ablow advised her to work as an escort or a stripper because the work was lucrative. This is your psychiatrist. Although the women used their real names in their lawsuits, the Globe is withholding their identities at their request. The Globe does not identify alleged sexual victims without their consent. However, 3 women who work for Ablow agreed to file affidavits, including in the lawsuits, knowing their names might become public. They said in the sworn statements that Ablow sexually harassed them too. One former staffer, Amy Dixon, said she had sex with Ablow during which he would regularly hit her and that he told her he wanted to have a master-slave relationship. Ablow's attorney, A. Bernard, I can't read that last name, said he had not reviewed the 2 new lawsuits, but said Dr. Ablow has been a respected and highly regarded psychiatrist who has for decades helped countless patients. He denied any and all allegations of improper behavior and substandard care in their entirety. Ablow has previously denied the allegations in one case, the lawsuit filed last year by a Minnesota woman. The plaintiff in this case was the subject of a no trespassing order by me 2 years ago and was ordered formally to stop harassing me, and her account is in collections for non-payment. Of course, her account is in collections for non-payment because you was charging her for the assault. Thursday, in a tweet, Ablow said he categorically, completely denies the allegations in the lawsuit. Allegedly, he was charging her. I look forward to the court proceedings and will continue to offer excellent care to any patient who needs my help, child. In all 3 cases, the women said they relocated from other states at Ablow's request to be closer to his new Berryport office, where he used controversial treatment for depression, infusions of ketamine. The drug is an anesthetic that can induce a trance-like state and memory loss. It's sometimes abused, but is also used by some clinicians to treat chronic depression. So he's drugging these women. He's raping these women. He's beating these women. And he's free. Andrea, a Lexington psychoanalyst who interviewed the women and reviewed their medical records as an expert witness hired by one of the plaintiffs, said in a letter filed with the lawsuits that Ablow's behavior in the case of the New York woman was sadomasochistic, anti-therapeutic, and constitute a perverse use of his status and power. The former patient said that during their 7-year sexual relationship, Ablow persuaded her to get his initials tattooed on her arm. Now this is actually, he's a psychologist. He actually knows how to brainwash you. Another expert said that Ablow appeared to be using ketamine in conjunction with talk therapy to gain control over a third patient woman from Ohio. I told you it's mind control. The patient appears to have become very dependent on this medication and dependent on how Dr. Ablow is to supply it, wrote Jeffrey Lieberman, a chairman of the psychiatric department at Columbia University, blah, blah, blah. Ablow is a prolific writer and commentator. In addition to his work for Fox, he has written numerous self-help books, novels, and works on nonfiction. Blah, 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 blah. But Ablow, 57, has stirred controversy for combining his psychiatric analysis with political views, once saying on Fox News that President Obama had abandonment issues and preferred Africa to America. though Ablow had never met him. He also criticized Michelle Obama's weight on Fox News in 2014, saying she needs to drop a few pounds. Yes, because that is under his area of expertise of psychiatric analysis. The patient from Ohio said she came with her mother to see Ablow in early 2015 when she was 25, receiving ketamine infusions from him. When she returned home, she said Ablow encouraged her to email him or text him daily. I had never had a therapist or any professional take such an interest in me, the woman said in her signed affidavit, adding that Ablow told her to send him even the most trivial thoughts. So he can know more about what you're thinking, so he can know how to control you. At some point, it became normalized and frankly necessary for me to communicate with Dr. Ablow several times a day. During therapy sessions conducted over Skype, the Ohio woman said Ablow would compliment her on her appearance and tell her he missed her. Soon he raised the topic of sexual preferences and asked his patient whether she preferred to be submissive or dominant. The woman said the conversation made her uncomfortable. Still, in March of 2015, she traveled to Newburyport again, this time alone. I asked Dr. Ablow why he had such a terrifying and strong effect on me, and he told me it was nothing to be afraid of. The woman said it was then that my sexual encounters with Dr. Ablow began. The Ohio woman said that Dr. Ablow soon persuaded her to move to Newburyport. As a further inducement, he allegedly offered discounts for the ketamine infusions and promised to arrange job interviews. He told me he could convince anyone of anything. The Ohio woman said Ablow would have her undress and perform oral sex, although he was careful to stop her before climaxing. Much later, when I confronted him about this, he informed me that he had a lot to lose and did not want to leave any evidence. The Ohio woman said that Ablow asked her to get a tattoo with his initials, but unlike the New York patient, she declined. The woman said Ablow would sometimes beat her as she kneeled. Damn. Sometimes he would use his hands and other times he would take off the belt he was wearing to strike me. This belt had a metal buckle with a skull on it. By early 2017, the Ohio woman said she realized she had to stop seeing Ablow for my own sanity. Eventually, after she started seeing another therapist, she succeeded in leaving him. Lord! I decided that I couldn't allow myself to be groped and used sexually and otherwise, or to feel so emotionally dead inside in exchange for prescriptions, even if I felt like I needed him. So I stopped seeing him, she said. The Ohio woman still fears Ablow and is plagued by nightmares in which he chases her with a gun because he discussed guns with her during their therapy sessions. Damn, he really did a number on these women. The former employee said Ablow could be threatening, displaying his handgun, making subtle hints that he would retaliate if they provided anyone with this unfavorable information about his practice. Dixon, who said she has manipulative sexual relationship with Ablow on and off for years, said he once pointed his gun directly at her. During sex, Dixon said Ablow would be so rough that he often left bruises and abrasions. But Andrea, the doctor that was analyzing the ladies, in her letter to the woman's attorney, said Ablow's alleged sexual misconduct with the Minnesota woman amounted to the most egregious violation of the American Psychiatric Association's ethical code. These behaviors are grossly unprofessional and unethical, she said, adding that they represent the worst and most damaging kind of abuse in a therapeutic setting. Janet McCarthy, who works for Ablow from May of 2014 to July of 2015, said Ablow would ask her to schedule appointments with attractive women who were sad and lonely, struggling with past trauma at times when no one else would be in the office. I was concerned that he was engaging in sexual contact with some of these women, she wrote. McCarthy said that she wrote her affidavit, hoping that by speaking out now, I am able to prevent Dr. Ablow from doing further harm in the future. So they got Bill Cosby for Benadryl. This is a psychiatrist using literal brainwashing techniques on his patients, abusing them sexually and physically, mentally, and he's just walking around. First them.